This ebook is brought to you by Agenvard 1998. Related research. Adlerian theory continues to generate a moderate amount of research on such topics as social interest, early recollections, family constellations, and style of life. We have limited our review to research on style of life and early recollections, ERS. Each of these topics offers potentially rich sources for understanding style of life and other Adlerian concepts. Social interest and criminal conduct. Adler wrote and lectured at length on the failures of life, that is, neurotics, psychotics, and criminals. He further contended that these people typically have low levels of social interest, the barometer of normality and the sole criterion of human values. Does research support Adler's view? Douglas Dougherty, Michael Murphy, and Justin Pa provided some evidence that low levels of social interest are related to criminal behavior. These researchers used the Solomon scale of social interest, SSSI, to measure levels of social interest among male prisoners. The SSSI is a 50-item, true-or-false instrument that yields a total score plus a score on each of two subscales: 1. Concern for and trust in others, and 2. Self-confidence and an optimistic view of the world. Dougherty administered the SSSI to prisoners who had been convicted of violent crimes and who were within 120 days of release to parole. The researchers followed these participants for more than 2 years after parole and found that parolees who scored low on social interest, compared with those who had higher scores, were less likely to be employed and more likely to have had subsequent felony arrests, total arrests, parole violations, and reincarcerations. Dougherty also found that social interest made a unique contribution to subsequent criminal history, that is, the effects of social interest were independent of demographic variables and criminal history. This study suggests that lack of social interest is clearly associated with criminal behavior and may be an accurate predictor of future crimes and subsequent reincarceration. Dougherty suggested that prisoners low in social interest and those with moderate social interest represent two separate groups, which may call for two distinct interventions. 3 groups were not possible because high levels of social interest are scarce commodities among lawbreakers. Offenders low in social interest do not usually benefit from traditional psychotherapy and may require more intense parole supervision, whereas offenders with moderate social interest may profit more from such Adlerian-oriented strategies as changing life goals, attacking faulty beliefs about courage, increasing self-confidence, expanding a constricted worldview, and enhancing concern for other people. Early recollections and personality traits. Research on the association between early recollections and present personality traits, style of life, typically uses one of two instruments: the Monaster-Perryman Manifest Content Early Recollection Scoring Manual or the Comprehensive Early Memory Scoring System. The Monaster-Perryman Manifest Content Early Recollection Scoring Manual, constructed by Guy Monaster and Thomas Perryman, calls for judges to score early recollections in 7 broad categories: 1. Characters, or people involved in the memory; 2. Themes, or topics of the ER; 3. Concern with detail, visual, auditory, and motor; 4. Setting, or location of the ER. 5. Active-passive, that is, the degree to which the person initiated action as opposed to being acted upon; 6. Internal-external control, or a person's acceptance of responsibility for what happened in the early recollection; and 7. Affect, or overall feeling of the memory. Internal reliability of the Monaster-Perryman is generally quite high. Research has shown a consistent relationship between early recollections, as measured by the Monaster-Perryman scoring system, and various personality traits. In a study of Pakistani college students, Arif Manzoor and Ghazala Rehman looked at the relationship between early recollections and traits of the 5-factor model, which we discuss in Chapter 14. The 5 factors are typically called neuroticism, extroversion, openness to experience, agreeableness, and conscientiousness, but other names are also used. In the Pakistani study, Manzoor and Rehman asked 40 male and 40 female college students to write about 2 early recollections. Next, They rated these ERS on the Monaster-Perryman scoring system and then compared these ratings to scores on the 5-factor model of personality. Manzoor and Remen found that students who scored high on extroversion tended to have early recollections that mentioned people, siblings, and mother. They also saw themselves as active and fun-loving. Participants high on agreeableness had early recollections that reflected high social interest and warm interpersonal relations. They frequently mentioned other people in their ERS, especially mother and other family members. Students high on conscientiousness mentioned early recollections that suggested organization, self-discipline, persistence, and reliability. High emotional stability, low neuroticism, scores related to composure, calmness, and self-satisfaction. Participants who scored high on intellect, openness to experience, tended to have early recollections that were high in diversity, creativity, originality, and imagination. In another study from Pakistan, Remen and Manzoor compared early recollections of young males in prison for murder with ERS of male college students of about the same age. Again, these researchers used the Monaster-Perryman scoring technique to assess early recollections of both groups. Remen and Manzoor found significant differences between the early recollections of the two groups. Compared with college students, young violent criminals were less likely to mention mother in their earliest recollection and more likely to have included experiences with injury, illness, fear, and anxiety. In addition, the violent criminals demonstrated lower levels of social interest and used fewer words to express their early recollections. A second early recollection scoring system, the Comprehensive Early Memory Scoring System, CEMS, was developed by Jeffrey Last and Arnold R. Brune. The CEMS is a multidimensional scoring system that assesses pathological and adaptive early recollection characteristics in 8 separate categories: 1. Characters, 2. Settings, 3. Sensory-motor aspect, 4. Relation to reality, 5. Object relations, 6. Themes, 7. Affect, and 8. Damage aspect. Some research has suggested that the CEMS may be useful in differentiating personality traits. Using the CEMS to score early recollections, Candace Nichols and Jess Feist hypothesized that optimists would report early recollections that were basically different from those of pessimists. They divided college students into two groups: those with an optimistic explanatory style and those with a pessimistic explanatory style, and found several important differences between the ERS of optimists and pessimists. First, optimists were likely to include other people in their early recollections, whereas pessimists either made no mention of other people or recalled others only as an afterthought. Second, participants with an optimistic explanatory style tended to see themselves as active, that is, they either initiated activities or were actively involved with others in play. In contrast, pessimists more often presented themselves as followers, observers, or victims. Third, optimists typically recalled events clearly and distinctively and used more adjectives than did pessimists. Also, optimists were able to identify their own motives as well as the motives of others, whereas pessimists were more vague and less likely to attribute specific motives to their own actions or the actions of others. Fourth, optimists frequently reported sustained interpersonal interactions in their early recollections, whereas pessimists recalled ERS in which their interactions with others were only sporadic, or they remembered other people interacting with one another while they were merely onlookers. Fifth, optimists recalled scenes in which they gained competence or mastery of an event, whereas pessimists often recalled scenes in which they failed to gain competence or mastery. Sixth, optimists recalled mostly pleasant early recollections in contrast to pessimists who were likely to recall unpleasant experiences. This and other studies tend to lend validity to Adler's notion that there are no chance memories and that people remember things from childhood that match their adult style of life. However, research that merely demonstrates a relationship between early recollections and present personality traits does not prove Adler's hypothesis that present style of life shapes a person's recall of early childhood experiences. The opposite explanation is possible, that is, early childhood experiences may cause present style of life. Early recollections and psychotherapy outcomes. If early recollections are fictional reconstructions amenable to present shifts in a person's style of life, then early recollections should change as style of life changes. This hypothesis is difficult to test because researchers would need to 1. Measure early recollections, 2. Assess current style of life, 3. Bring about changes in style of life, and 4. Reassess early recollections. If changes in early recollections tend to track changes in personality variables, then ERS could be used as criteria for measures of psychotherapy outcomes. Some evidence exists that early recollections do change through the course of psychotherapy. For example, Gary Sable and Daniel Eckstein obtained early recollections and mental status of psychiatric patients both before and after therapy and compared them to ERS and mental status of a matched group of control participants. They found significant changes in both mental status and early recollections for the therapy group but not for the controls. Consistent with Adlerian theory, this finding indicates that when therapy is successful, patients change their early recollections. Similarly, Jane Staton and Bobby Wilborn looked at the 3 earliest recollections of 5 to 12-year-old children after each of 10 weekly counseling sessions and compared them with the early recollections of a control group of children that did not receive counseling. The researchers found that the counseling group showed greater changes in the theme, character, setting, amount of detail, and level of affect of their early memories. In addition, they reported one dramatic example of how early recollections can change as style of life changes. One young child recalled that my uncle and dad took me fishing. They were fishing and my uncle got his line hung on a tree stump in the water. He yanked on the pole and the hook came back and hooked me in the head. I waited for them to pull it out of my head. After counseling, the child recast this passive early recollection in a more active light. I went fishing when I was about 5. I caught a fish and my uncle threw his line out and he got it hung on a tree stump and he yanked it back and the hook came back and got me in the head. I pulled it out. This research is intriguing because it suggests that early recollections may change as a result of psychotherapy or some other life-altering experience. These results tend to support Adler's teleological approach to personality. Namely, early childhood experiences are less important than the adult's view of those experiences.